The essence of Alzheimer's disease, which is known as type 3 diabetes, it's the defeat of your innate immune system. So what is your innate immune system? Your innate function is your born ability to actually use your immune system to actually fight things off like invaders and inflammation. And over time, especially when we're talking about diabetes, that inflammation, it gets way out of hand. And unfortunately, what winds up happening is Alzheimer's sets in, and it is absolutely a mess. Unless you make sure that you pay attention to three things that you're absolutely going to need to know by the end of this video that you're going to want to make sure that you write down if you're a diabetic. Hey everyone, it's Dr. Patel with the Diabetes Free Life Group, and I am happy to be with you here today, bringing information that you must have in order for you to be able to age gracefully, in order for you to actually live with a life that actually has health and healing. And we can all do it. You can do it. You know, chronic disease doesn't need to be in your future. So here we are in the Diabetes Free Life Group on Wellness Wednesday. And today, as you heard, we've been posting, we're going to talk about Alzheimer's disease. And the medical literature refers to Alzheimer's disease as type 3 diabetes. In a condition where, you know, when we talk about diabetes and glucose and inflammation, what does it start doing? It actually starts destroying your brain function, and blood sugars cause the brain to actually begin to shrink. Like if someone were, we'll use the example, if someone were standing right beside me here and they were standing right beside me and they were tapping me on the side of the head, what would I do? I'd actually pull away. I'd try to protect myself. And that makes sense, right? But inflammation is that tap on the side of your head, and the neurons, the brain cells actually begin to retract. They pull away. They try to protect themselves, and they actually begin to shrink. This is the nature of Alzheimer's disease, and it's a process where your brain cells begin to retract, they become smaller, they try to preserve their own life. If you've ever been around a loved one that had Alzheimer's or dementia, you know, both of those conditions really go by the same name. You know what I'm talking about here. You know, life goes on, but their personality is no longer plugged into their brain. And it's absolutely heartbreaking. It's gut-wrenching. This is why you can see so many people, unfortunately, live excruciating lives, 10 years, 15 years, maybe even 20 years with this condition. That's robbed them and those people who care about them of the quality of their life. It's like driving a car and you hear an issue with the engine. Well, what do? You slow down. You want to throttle down. You decrease the energy output. You try to save the engine. Same thing here. Your brain actually slows down. It decreases the energy output, try to save itself, what's left of it. So I was reading some medical literature just the other day, and like usual, I found an article that really piqued my interest, and it's about inflammation. It's about fungus and Alzheimer's disease. And they presented a really unique observation in the study of these patients with Alzheimer's disease, and they noticed that the brains were actually colonized by fungus, like real fungus, like the stuff that you don't like seeing on your fruit when it goes bad. Fungus grows on food because what does it do? It eats off the sugar. It perpetuates itself, right? It colonizes itself. It grows. And that makes sense, right? When you think about the risk of Alzheimer's disease, I want you to hear this, and I want you to hear this tonight a couple of times. Because if you have diabetes, you have an increased likelihood, 56%, of actually having Alzheimer's in your lifetime. If you've been diagnosed as being a diabetic. And I want to say that one more time here. You have an increased likelihood of developing Alzheimer's in your life if you are diabetic by 56%. The research is clear about that. So back on this fungus, what we're talking about here. So this fungus, what does it do? It begins to wear out your immune system, your body's ability to actually be able to control it. And what is the fungus doing? It's feeding on the sugar. And hey, when you have a lot of blood sugar, like diabetes, it's a perfect breeding ground for mold and fungus. This research that I attached here to our live, the research looked at amyloid proteins in the brain. Basically, amyloid proteins are like scarring in the brain. And that's the hallmark of Alzheimer's disease. And it's evidence in the immune reaction trying to control fungal outgrowth. And it's pretty important here. Most medical approach to address Alzheimer's disease, listen, it's failed, and it's failed miserably. They're trying to limit the production of these amyloid plaques through what? Drugs, prescriptions, through drug intervention. Instead of asking what we typically will ask in this group, right? Well, what's generating the plaques in the first place? I hope that makes sense. You have to look at why the body's making these plaques in the first place. And according to the research, the answer is here. It's fungus. So where is it getting in? Essentially, it's getting in by two really important systems inside of your body. and that's your lungs and your gut. When patients or people who are going through these issues and they live in places that are moldy environments, water damaged buildings, whether it be at home, whether at work, or even eating food that's been grown in wet fields, packaged, and then once it's packaged, it sits on a shelf, right? And when it sits on a shelf, it's generally for months and months and months before it begins to be opened up and consumed. And guess what? The mold and fungus that you're exposed to end up getting in your blood. And how do they get in your blood? Through the lung barrier, through the gut barrier. You probably have heard it said that your health actually begins and ends where? In your gut. Well, that's kind of true to some extent. But I'd also like to add that we know it also comes through your lungs here as well. The lungs and the gut are two main areas where we have an exchange in the external environment that we live in. And that happens how? Through things like food, things like air. I'd also tell you it also happens through your skin, but that I think is going to be a conversation for a different day, a different Wellness Wednesday here. But let's keep focusing on the lungs and guts, especially when we talk about sensitivity to things like molds and fungus. So what happens is the farmer grows the grain, it gets harvested, it gets dried, it gets milled, it gets baked, it gets packaged, and then it gets purchased. And inevitably what winds up happening is it gets consumed. And that process takes time, right? Mold and fungus, they love time. Time to grow, time to go unnoticed. Listen, it also happens here when we talk about like rain getting behind your sheetrock, and then the mold and the fungus starts to grow, and you just go about your business, not realizing that you're getting radiated with mold spores. While you're at work, while you're sleeping, fungus works its way into your body through these different barriers that we're talking about here, your lungs and your gut. And it's one of the things I commonly test diabetics for because guess what? Fungus and mold just don't cause Alzheimer's. Remember, I've said it already a couple of times here. When you're a diabetic, you have an increased likelihood of developing Alzheimer's in your lifetime by 56%. So has its own unique reasons. And what happens is this fungus, it triggers your innate immune system. The one that you're born with, what does it do? It drives up inflammation. And if the driver is never handled, if it doesn't get taken care of, and you continue to live in environments that are exposing you to fungus and you're eating food that's giving you mold exposure, you get stuck on the pain train as it relates to out of control diabetes and making good on Alzheimer's to develop. And of course, if that's what you don't want, then you're left to try and sort it out. What do you try to sort out? How to live a life that's not getting hammered by fungus and mold and these things that we're talking about here. It definitely could be a real challenge when you start poking around because there are so many different sources for testing, so much different information, that ideas that are out, the ideas of what's important, what's not important. And think about it. Listen, I know what I'm looking for, and it's taking me years and years of studying my tail off to put together an approach that actually works and works really, really well. One of the things you hear me say often in our group is, listen, information is cheap. Wisdom is what you want to find. That's why we're doing this, by the way. That's why we're hosting these events when we talk about Wellness Wednesday, so that you don't have to spend a decade of your life reading the medical journals, right? That's my job, and trying to figure out how to get well without having to take a pile of drugs and inject yourself with needle after needle. Anyway, fungus and mold, they work in your way into your body through lungs and gut, and it plays itself out in practice as well. When we run things like toxicity panels, showing people that they actually have mold and fungus literally off the charts living inside their body, and it's driving inflammation. It's driving diabetes, and it contributes to their cognitive decline in ways that they had no idea was actually happening. Generally speaking, when we talk about this kind of disease process, it's a slow process. Sometimes starting literally in your 20s and your 30s, and you have no idea about it. You just think it's normal aging. Just because that's what happens to people around supposedly your age, right? As you get into your 40s and your 50s, it starts showing up more and more and more, and you start slowing down. Weight starts coming on, brain fog. And then those things that they say are senior moments, right? The forgetfulness. It's not normal. It's just common. And just because something is common doesn't make it normal. Almost 10% of the population right now has diabetes and almost 40% of the population is obese, and Alzheimer's is absolutely skyrocketing, and it's all the same mechanism. It's a chemical problem, and it's not going to get solved by starving yourself or keeping your sugars down. While you might not have Alzheimer's or cognitive decline yourself, you very well might have mold and fungus cruise around in your bloodstream, and you might have no idea that that's the case. How do you know? How do you know? Well, I'm going to share some of these things with you here. Things like fatty liver, kidney disease. Those are two really super famous complications that always happen when we talk about these issues. And those issues are actually called biotoxin illnesses, illnesses that come about through things like mold and fungus. If you have fatty liver disease, if you're listening to me right now, even if they call it non-alcoholic fatty liver disease, right? NASH. That's what I'm talking about. I'm talking to you right now. If you have kidney filtration rates that are less than 60, I'm talking to you right now. Alarm bells should be going off right now. It's not normal to have these two issues as you age. You shouldn't have fatty liver disease. You shouldn't have kidney disease. Just because your doctor sees, I don't know, 3,000 patients a year and they all have the same problems doesn't mean that those problems are normal. Please get that. Aside from getting your house checked and maybe getting those things handled, eating real food that isn't sitting on a warehouse shelf that goes on ages and ages and ages. So what are you going to do? So what I want you to do right now is I want you to grab a pen, because here I'm going to give you some things that I really want you to focus in on. If you're listening to this recording here live, I am live right now. Afterwards, you can rewind and you can write all these down. If you're listening to the recording, you can hit stop if you're listening to me after the fact, but I want you to really pay attention. I want you to write this down. Okay. This means making sure that you have the ability to buy air filters, the kind that actually plugs into the wall in the room at night. I want you to do that. If you can't look behind your sheetrock, or if you're sitting in a house that you can't get out of, at least make sure for your people that you care about, for yourself, your loved ones, make sure you get air filters in your house. You're going to take care of your water. Absolutely, without question. This means making sure that you're drinking purified water. These things come in waters. It comes in through the water, and it actually makes these chemicals come inside of your body. Purified water can help clean your gut. Purified water can keep your kidneys healthier, your liver healthier, right? Healthier than if you didn't have them. So fresh, clean water is super important. So we've talked about two things: air purifiers, and now we're talking about fresh, clean water, right? Next thing, you got to make sure that you have some kind of fresh food plan. And that's what I would do. You got to find someone who can help you organize your lifestyle, not only avoid mold and fungus, but help make sure that you drive them out, what's already been inside of you. And if that's us, if you're working with us, then that's cool. If you have someone in your life that you're already working with, well, that's cool too. But at the end of the day, you have to find someone, or you have to find a plan that's going to push what's out of you. Avoid it. Make sure that you move that trash out of your body, especially if you already have prescriptions for things like cholesterol, blood pressure, blood sugars. These are all indicators that you might have some kind of biotoxin illness. That means that those barriers that we talked about, your lungs and your gut, they're already compromised, and no one's talking to you about it. They just tell you, hey, I'll see you in 3 months. Make sure you get your refills filled. Your numbers are looking pretty good. As long as it's below 7, they're really happy. Don't let that be you. Read the article that I've attached here. Read this article. Read it if you want to, right? It's super helpful to understand that there's more to health than what we've just talked about here, right? Than just saying, well, it's my genetics. I guess I'm going to have to just learn to live with this. And what do? You just wave the flag and you just say, well, I'm just stuck. And you play a role of victim. You can have different. You can know different. And when you know different, you can live different. It just takes the right information at the right time. That's called wisdom. Knowing what to do, but more importantly, when to do it. All right, let's do this. Let's end it here for this evening. I appreciate you guys being here this evening. Want to wish you guys absolutely a blessed night. And I look forward to seeing you next time on Wellness Wednesday, or maybe I should start calling these Wisdom Wednesdays. But have a blessed evening. We'll talk soon.